Today, colorectal cancer is the second leading cause of cancer deaths in the United States for men and women combined. But if found early, before it has spread, colorectal cancer can be treated successfully in 9 out of 10 people. Early detection is the key to survival.
Joe, now that you're turning 50, I'd like to talk about a couple of tests.
Many people aged 50 and older develop polyps. It is estimated that nearly a third of all colorectal cancer deaths could be prevented if people over the age of 50 were screened on a regular basis. Regular screening tests are the only way to find colorectal cancer in its early stages when treatment is most effective. And colonoscopy is the only recommended screening test that allows your healthcare provider to look for polyps or cancer by examining the entire lining of your colon and rectum and removing any polyps that may be there. To better understand the importance of early polyp removal, let's look at how colorectal cancer can develop. The digestive tract is the system in your body that takes in food, absorbs its nutrients, and gets rid of waste. The colon and rectum are part of your digestive system and the place where colorectal cancer can develop. Normally, the inside walls of the colon are smooth. But in some people, for reasons not fully understood, the walls of the colon change. Over time, small mushroom-like growths called polyps form. If these non-cancerous polyps are left untreated, over time, sometimes many years, they may develop into cancer. You may not notice any obvious symptoms until the cancer is large and has spread. At that point, the possibility of curing the cancer is reduced. Fortunately, having a regular colonoscopy may detect polyps early and allow your healthcare provider to remove them before they have a chance to develop into cancer. Various professional societies, including the American Cancer Society, recommend people at average risk begin screening with colonoscopy by the age of 50, and if no polyps are found, every 10 years after that. For people at a higher than normal risk, earlier and more frequent testing is recommended. This includes anyone who previously had a polyp removed, anyone who has already had colon cancer, breast cancer, or ovarian cancer, or anyone who has had an inflammatory bowel disease for a significant amount of time. Family history is also very important. Anyone with a blood relative who has had colon polyps or colon cancer is also at increased risk.
Because of your family history, it is recommended that a colonoscopy be performed at age 40.
Talk to your healthcare provider about your risk factors and when you should have a colonoscopy to screen for colorectal cancer. Your doctor will use a thin tube called a colonoscope to see inside your colon. It can bend to move around the curves of your colon, showing a complete picture of your large intestine. The colonoscope is operated by remote control and has a tiny camera and light on one end that sends pictures back to a video screen to show the lining of the colon in detail. If your doctor sees any abnormalities in your colon, he can thread tools down through the scope to fix the damage or take tissue samples. A colonoscopy is safe, but every medical procedure does involve some risk. Some of the risks include perforation or tearing of the colon lining, bleeding from the removal of a large polyp or biopsy, infection, missed polyps, or you may have a reaction to the sedative medication. Make sure you tell your doctor about any allergies you have, especially ones to medication. Most patients and doctors feel the benefits of a colonoscopy far outweigh the risks.
There are several ways to prepare you by cleaning out the colon.
Properly preparing for this procedure is very important. In order to see the lining of the colon clearly and to avoid complications, your bowel must be completely empty. If it isn't, your doctor may not be able to perform the procedure. Ask what preparation method is best for you and follow the instructions. Several days before your procedure, you may be asked to start drinking more liquids in order to prevent dehydration. Before your procedure, you may be asked to eat and drink only clear liquids. This means you can eat things like strained soup or bouillon, but must avoid solid foods. You may also be told to avoid eating things that contain red dye, like cherry jello, because it can color the lining of the colon. You will take a laxative or cleansing solution before the exam to completely cleanse your bowels. Laxatives and solutions will have to be repeated until there is nothing solid in your system. In almost all cases, you will not be able to eat or drink anything for several hours before your exam. Tell your doctor what medications you are taking. He may ask you to stop taking them or change them a few days before your colonoscopy. On the day of the exam, arrive at the hospital or your doctor's office wearing comfortable clothing. Before the procedure, you may have to take off your glasses or remove your contact lenses, and you will put on a hospital gown. Your doctor will ask you to sign a consent form before the procedure. You may be given fluids through an intravenous needle in your arm. Your blood pressure and pulse will be checked. You may be given extra oxygen throughout the examination.
So if I can get you to roll up onto your left shoulder and hip.
You will lie on your left side. A mild sedative is given to you through the IV needle in your arm. This medication will make you sleepy and relaxed. As the lubricated tip of the scope is gently inserted into the rectum, air is pumped in to inflate the colon. This keeps the colon open, giving your doctor a clear view while the tube is carefully guided through the bowel. Your doctor will look at the lining of your colon thoroughly as the scope travels to the end of your large intestine, and then once again as the scope is removed. To help the passage of the scope, you may be asked to turn on one side or the other with the help of the nursing staff. You should not feel any discomfort or pain during the procedure, but if you do, tell your doctor. This is video taken during a colonoscopy. As you can see, your doctor will have a clear view of the inside lining of your colon. If a tiny growth called a polyp is found, your doctor can remove it completely with metal forceps or a thin wire snare before it has a chance to develop into cancer. The snare is placed around the base of the polyp and tightened until the polyp is cut off. A mild electrical current stops any bleeding. This is a painless procedure called a polypectomy and is often performed during colonoscopies. A tiny bit of tissue is then sent to a lab where a biopsy is performed. If there is any bleeding in your colon, your doctor can use a heat probe or medication to stop it. Your colonoscopy should take between 15 and 45 minutes to complete.
Okay, I'm going to take you to the recovery room now. You did really well.
Because of the medication, you may feel sleepy for the next 8 to 12 hours, and you may not remember what happened. Even if you feel awake, your judgment and reflexes could be slowed, so you must have someone drive you home after the procedure.
And you understood all your discharges?
Do not return to work, drive machinery, including your car, drink alcohol, or sign legal documents until the next day. Because air was pumped into your colon, you may feel bloated, have mild cramps, and gas. You will feel more comfortable if you expel this gas. You may also notice a spotting of blood in the stool. These minor side effects should go away within 24 hours, but if they don't, or if they become more severe, call your doctor. Although complications from the colonoscopy are rare, it is important to recognize early signs of possible problems. Contact your doctor if you notice severe abdominal pain, fever and chills, rectal bleeding, or redness or pain at the IV site up to several days after the procedure. Your doctor will discuss the results of your colonoscopy with you following the procedure. If any tissue samples were taken, you may have to wait for the lab results to come back for a full and accurate evaluation. Your doctor will give you instructions on how to care for yourself when you get home, including what medications to take. Don't overdo it. Start out eating lightly and gradually increase the amount of food you eat. By having a colonoscopy, you are taking the right steps to detect any polyps. Remember, finding and removing polyps at an early stage decreases the risk of cancer ever developing. And if a polyp is cancerous, finding it early and removing it can stop the cancer from spreading. Colonoscopy can greatly reduce your risk of developing colorectal cancer and improve your chances of early detection. Talk to your doctor about your options, make a screening schedule, and stick to it.